Hey, okay, another quick video on 99408 and 99409, which is EtOH and substance abuse, which is other than tobacco. So I have 99408 over here and 99409. Essentially, the 99408 is for any intervention, and I'm going to put up some guidelines in regards to what you have to document, but it's any intervention about alcohol abuse, which we have a ton of patients who come in with alcohol abuse, and we typically counsel them, even acute pancreatitis coming in secondary to alcohol abuse. We do counsel them easily above 15, anywhere between 15 and 30 minutes on alcohol cessation, which is the cause of them coming in. So we need to be billing for this CPT code. And then 99408 is where, excuse me, is where you do the same thing. It's counseling on substance abuse and how to quit that goes on for more than 30 minutes. So if it's just a brief 15 to 30-minute counseling session, it's 99408. And if it's a little bit more extensive, going over 30 minutes, it's 99409. The criteria for this is, and again, it's alcohol abuse and it's any non-tobacco substance abuse. So that can be nicotine abuse if they're vaping, that can be cocaine abuse, polysubstance abuse, even narcotic abuse if you've established that they are abusing narcotics or they've admitted to it and you've gone through this stepwise process of counseling them on it as well as documenting it properly. So the 5 bullet points are that you want to put in your documentation is how long have they been using the drug. And this can't be a medication that they're like, you can't drop it at 99409 for a patient who's on chronic narcotics for, let's say, back pain. You have to establish that this is some sort of abuse. So the narcotics are hard, but obviously um, drugs like cocaine, heroin, fentanyl on the street, these are not therapeutic medications typically. So how long have they been using the drug? What did you cover? So what did you cover with them in regard to giving them a plan to quit? So that can include support groups, giving them resources, letting them know about programs, especially with alcohol abuse, talking to them about Alcoholics Anonymous, which I believe has been the most effective in regard to getting patients to quit drinking as well as preventing relapse because of the concurrent sponsor program. What had they tried in the past and why did those things fail? What could they be looking at quitting differently? Or maybe they have triggers in their life that are preventing them from being able to quit. What is the plan? So let's create a new plan going over some of the failures in the recent past trying to quit. What has failed then and what can we change now so that our plan is successful? And then you have to put how much time you spent counseling. And again, for the 99408, which is right here, it's anywhere between 15 and 30 minutes. So in your note, you would just put, I spent 20 minutes counseling the patient on EtOH cessation and devising a plan, as well as going over their history and what they've tried in the past. Or you can say, I spent 35 minutes counseling, which would be a 99409. What's really important here is the E&M. So when I talk about prolonged services and your classic level 3 E&M, um, that total time is only pertinent to the time spent addressing these patients' problems. So the only time that should be included in your total time statement at the end of your note should be the total time included to do your progress note in this particular situation, 99233, plus any prolonged services that you have after that. So if you have 2 or 3 99418s on top of it because you spent, 45 minutes on top of your typical 50-minute E&M, an example being your 99233, that would be the only total time that you put at the end of your note. Anytime you do alcohol or substance abuse counseling, or you do tobacco cessation counseling for more than 10 minutes, or you do advanced care planning for more than 30 minutes, that time is not going to be included in your total time for the note. That is going to be separate in your assessment plan. So if you do have a note, you would, and I do have tobacco. So I would, like, let's say my assessment is tobacco abuse. And then my plan would be, I think it's Katie tobacco, right? So counsel the patient on more than 10 minutes for tobacco cessation or 10 minutes plus. And then when I have my total time statement for it, this total time, whatever it is, 55 minutes, and I do have a phrase that I use detailing what exactly I'm spending on. This 10 plus minutes should not be included in this. This is your total time that you spend addressing all these patients' problems, the reason why they're admitted, and then these extra 10 minutes are extra 10 minutes that you spent just talking about tobacco cessation, EtOH or substance abuse cessation, advanced care planning, or what have you. Um, and that's it. I think the other thing I wanted to cover really quickly was that the tobacco abuse, as well as the advanced care planning and this 99408 and 409 EtOH and substance abuse can only be billed one time per encounter. So if you go back to look at all the bills that's been billed so far, or you go to all charges and notes and you look at all the bills from your same specialty, if someone before you who was seeing this patient has already billed for tobacco cessation, or they billed for counseling on non-tobacco use products like EtOH or substance abuse, you can't bill again. So if they've already billed for it, you will not be able to bill for it again. You can carry this statement forward in your note, just saying that at some point you did speak to the patient, but you can't bill for it every day. You can't have a 30-minute conversation with patients about drinking every day. It can only happen once during that encounter. Okay, thanks.